Yeah, is the screen visible to everybody?
Yes,
Yes,
please.
sir.
Right.
Yes.
Right. Okay. We are now the emphasis today is, of course, the integrated questions, and we very clearly know that an integrated curriculum cannot run without having appropriate assessment, and so that's the basis of this workshop. Let's look at the learning outcomes which we want to achieve in this workshop. First, explain the principles of integration in the curriculum and their influence on construction of integrated questions. The emphasis would be how the principles of integration influence our construction of integrated questions. Second, state the different levels of integration and the curriculum and their impact on the construction of integrated questions. So how different levels of integration would impact the construction of integrated questions. So yeah, I'm sure many of you would know about the principles of integration and the levels of integration. We actually don't want to go into the details of these areas, but we want to see how these influence our approach to construction of these questions. Then discuss different methods of assessment of students following integrated curriculum. Construct valid and reliable multiple choice question and structured essay questions for assessment in an integrated curriculum, and manage common flaws in the construction of integrated multiple choice questions and structured essay questions. So these are the 5 learning outcomes which we will, inshallah, achieve by the end of this workshop. Now let's start with first the concept of integrated curriculum. A fully synchronous, transdisciplinary delivery of information between the foundational sciences and the applied sciences throughout all years of medical school curriculum. Let's look at this definition in a bit more detail. Fully synchronous means real time. Transdisciplinary. The difference between interdisciplinary and transdisciplinary, it becomes important to understand, to know this definition. Interdisciplinary, the boundaries of the disciplines still are maintained. When we say transdisciplinary, means that we are going beyond the borders of the disciplines, or we are breaking the borders of the discipline, and that's what this integration aims at. So it's a real time, and it's beyond the borders of different departments or discipline. The delivery of information between foundational sciences, of course, basic sciences, and clinical sciences throughout all years of a medical school curriculum. So this seems to be a very comprehensive definition to give the concept of what integration in curriculum is. Another view is the organization of teaching matter to interrelate or unify subjects frequently taught in separate academic courses or departments. We know that we have departments. We can also divide the curriculum in so-called preclinical phase and clinical phase, but the integration tries to interrelate these subjects beyond the boundaries of departments. And third, the teaching different subjects, areas in a thematic manner so that the different disciplines are not emphasized. So it means that teaching is under themes, not under discipline. And you will see it will be very clear when we go into the detail that the different disciplines or different specialties or subjects, they are contributing to the theme, and the emphasis is on the theme and not on the discipline. So these three definitions give really the concept of integration in curriculum. This is a statement by General Medical Council of UK. We strongly favor true integration of the course, both horizontal and vertical. We'll go into the details of what is horizontal and what is vertical. Using the term in the sense of interdisciplinary synthesis, as I mentioned earlier, going across the borders of discipline, and not simply coordination or synchronization of departmentally based components. So looking at the horizontal and vertical integration, horizontal information taught in the same curricular phase is taught together, usually focused around a theme or a problem, means the integration between the basic sciences or in preclinical phase, or integration between the clinical sciences in the clinical phase, but not between basic and clinical sciences. So this is the horizontal integration. Whereas vertical integration is information taught in different curricular phases, phase 1 or phase 2 or preclinical and clinical, and it is taught together, usually focused around clinical theme or disease. So it includes, when we say vertical integration, we are assuming at the same time that there is also a horizontal integration. And now, if you look at this diagram, it doesn't touch zero, not at the bottom, not at the top. So means there is some clinical input even from the very beginning, but of course it increases along the time. And similarly, the basic sciences keeps on the part of the curriculum even towards the end of the graduation. So this is the integration. And then when there is basic and clinical sciences together, that is vertical integration. And this concept should be reflected in the assessment. So assessment must reflect on horizontal and vertical integration. Our questions, our methods of assessment, our tools of assessment must reflect, must show the both horizontal and vertical integration. Like 5 principles of integration and how they influence the assessment in an integrated curriculum. The integration focuses on key issues as it promotes learning in context, for example, in clinical scenarios. So the assessment must be in the context as well, following the principles of integrated curriculum. Second, it adopts holistic approach. So therefore, the assessment must be holistic as well. Thirdly, it focuses around core curriculum or must-know knowledge. So assessment should be minimum of essential knowledge and skills. So this is the first principle of integration, focus on key issues, and this is how it affects or influences our assessment. The second principle, integration enhances construction of knowledge through integration of basic and clinical sciences. So therefore, integrated assessment of basic and clinical sciences is required. Integration enhances construction of knowledge through deep understanding of new concepts. So that means that we should have higher level of assessment, which is between, let's say, if we look at the Bloom's taxonomy, I'll go into a bit detail later on, but between 3 and 5, the third and fifth level of, so that should be our aim, our focus of developing questions that they are addressing at that level. The integration enhances construction of knowledge through identification of gaps in knowledge, search for answers, use of resources, for example, as we do in problem-based learning, and application of newly acquired knowledge to solve problem. For example, what we do in case-based learning. So assessment of case or problem-solving skills is the focus of integrated assessment. The third principle, integration promotes application of knowledge to real-life situations by learning through problems, problem-based learning or case-based learning. So therefore, the assessment must be carried out through use of problems, using knowledge gained to solve new problems or new situations, as we do in case-based learning, getting feedback and improving the learning. And so these should be, this is how the third principle should be applied to the assessment. The fourth principle, that the integration fosters critical thinking and lifelong learning skills through generating hypotheses, for example, in problem-based learning, interpreting data, for example, in case-based learning, searching evidence, making decisions, finding relationships, identifying differences, and all these aspects must be part of our assessment in an integrated curriculum. The fifth principle is that integration enforces staff development by improving teaching skills and also subsequently improving assessment skills, mastering new techniques, so in teaching as well as learning new assessment tools and techniques, learning how to give constructive feedback, enhancing evidence-based teaching, so using evidence-based assessment methods, and keeping high standards both in teaching and assessment, and achieving excellence in areas of expertise. So this is how the 5 principles of integration influence our assessment in an integrated curriculum. Next, looking at the 11 levels of integration, we wouldn't go into all the levels of integration, but we will see how some examples that level of integration can have impact on our development of our construction of our questions for assessment of students in an integrated curriculum. In SPICE's model for educational strategies, integration is presented as a continuum with full integration at one end and discipline-based teaching on the other end, and with intermediate steps in between. So integration is not just one absolute entity. There is a continuum. So if we start from discipline-based and then move on to full integration in curriculum, so there would be number of levels, number of stages which would come. So that's why we have, Harden has described these 11 levels of integration. And again, what level of integration is there in our curriculum would influence the type of questions we are going to construct for assessment of students. Here are those 11 levels: isolation, awareness, harmonization, nesting. Temporal coordination is where the timetables are coordinated, followed by sharing, correlation, complementary, multidisciplinary, and interdisciplinary. Like we were talking about interdisciplinary, so that is, and then the transdisciplinary, which is the highest level of integration, means where the borders of the departments are not respected anymore, and it goes across the disciplines. So if we summarize these 11 steps in the ladder, the first 4 steps on the ladder, the emphasis is on the subject or discipline. So there is almost no integration in the first 4 levels. Then the following 6 steps emphasize the integration across several subjects or disciplines, mainly under themes. And then the final step, which is the 11th, which is transdisciplinary, the student takes more responsibility of the integration and is given tools to do so, which of course is very, very challenging to implement. The 8th level, which is the complementary program or mixed program, I am talking from 8 to 10 because most of the medical schools are practicing at that level. So in complementary program or mixed program, the integration sections present a major feature of the curriculum. So the significant part of the curriculum is taught through integrated sessions. And the focus of teaching is a theme or a topic to which different disciplines contribute. I'll give an example of that, what is a theme and how do we arrive at a theme, because that would help us to understand that how this level can influence the construction of our question and how it can guide us. So let's take the example of hemopoietic hematology and lymphoid system module in our, let's say, so-called preclinical years. And we see that in this module, first we see, let's say it's a hemopoietic or hematology module, and see which are the major disciplines which has a major contribution. Of course, all the disciplines would have contribution, but we know that different disciplines have different level of contribution in different modules. For example, musculoskeletal would probably anatomy would be the main contributor. If we see in the hemopoietic and hematology module, the major contributing disciplines may be physiology, biochemistry, pathology, and pharmacology. So what we do is that we request these 4 disciplines to list down their 3 topics which they want to start with, or the initial 3 topics. They may have many topics, but what are the 3 topics which they want to start or they want to teach first? And let's say we, and then let's say we say that physiology says that they want to start with hemopoiesis, biochemistry want to start with structure of hemoglobin, pathology want to start with anemia, and pharmacology want to start with iron therapy. So if we look at these 4 topics, we can easily say that anemia is one theme which can cover all these 4 topics: physiology, biochemistry, pathology, and pharmacology. So the theme of the week can be anemia, and we can cover hemopoiesis, hemolysis, or hemorrhage, all the 3 aspects of anemia. When I say the theme of the week, it's not necessarily limited to just 1 week. Depending upon the content to be covered, it can be more than 1 week following the same theme. Now, if we have this theme of anemia, so how would our timetable would look like? Now, this is hemopoietic and lymphoid system module. This is the week 1, and theme is anemia. And then we have now this is an integrated timetable, and it is a very comprehensive timetable. If you look at it, every box, for example, this is a hemopoietic module. this is a physiology session, and by the physiology department, and this is the lecture room. So what this timetable can, in just one glance, can give all the information about the activity. Now it starts with, for example, normal hemoglobin by biochemistry. Then next is the hemopoiesis by physiology. Then the blood grouping also by physiology, but then comes the hemolytic anemia by pathology. So if you see, multiple disciplines are contributing to the theme of anemia. So emphasis is, our focus is on anemia rather than different disciplines. And it also has vertical integration, where the initial history taking and general physical examination, not so detailed, but the basics of that would be introduced here. So this is what we mean, a theme-based teaching, or theme-based learning, and theme-based program, which is the major tool of implementing integrated curriculum. And these themes would make the basis of our questions. Later on, we will see that how these themes and timetable will help us to identify the areas where we want to develop our question. So this is the level 8. If we look at the level 10, which is interdisciplinary, means that there are some boundaries of disciplines are still there. And in interdisciplinary integration, there is a further shift of emphasis to the themes as a focus for the learning. Themes usually start from the 7th and 8th level and then keep on increasing. So in level 10, obviously, the number of thematic sessions would be more than the level 8. Interdisciplinary teaching implies a higher level of integration with the content of all or most disciplines combined into a new course with a new menu. I read it again. Interdisciplinary teaching implies a higher level of integration with the content of all or most disciplines combined into a new course with a new menu. One example is One Health. It's a new specialty being developed where it has been realized that the human health is linked to animal health, to plant health, and environment. This is mainly to tackle the endemics and epidemics. And after the COVID pandemic, the emphasis on it has increased. And obviously, we all know that the health of human, animals, plant, and environment is interlinked. So by combining these areas from all these components, there can be a new integrated course or new degree on One Health. There may be no reference to individual disciplines, and they are not identified as such in the timetable. Only topics are given. Implicit in the move from multidisciplinary to an interdisciplinary approach may be the loss of disciplines perspectives. And the common learning outcomes from different disciplines are identified, and integrated teaching, learning, and assessment is planned and implemented. So let's say example is pediatric and community health, or maternal and child health. So what happens is that the learning outcomes of both pediatric and community medicine are identified, and then the common learning outcomes are separate, and they are taught together in an integrated fashion. So this is the basic concept of integration, how the principles of integration can influence our assessment, how the levels of assessment can impact on our assessment methods and approach, and the how thematic approach can influence our assessment. So with that, let's look at the written assessment in an integrated curriculum. The essentials of integrated assessment based on what we have discussed so far, I think we can summarize here. So higher levels of Bloom's taxonomy, which is level 3 to 5, assessment in context, must know knowledge, the minimum requirement, horizontal and vertical integration in questions, critical thinking, problem-solving skills, decision-making skills, and holistic assessment. So this is how we can summarize all the previous discussion in these points. And again, now from here onward, once we have identified these essentials, we can work on the construction of questions. This is just to remind ourselves what we mean the level 3, 4, and 5 of Bloom's taxonomy. Third is the application, and here are the type of verbs which we can use when we are assessing the level 3 based on the Bloom's taxonomy: practice, calculate, implement, operate, use, or illustrate. Then is the analysis level, and then is the evaluate level. I didn't mention the create level, which I think goes for more for postgraduate. So but these 3 levels would apply appropriately for our undergraduate curriculum. And when we are constructing these integrated questions, we have to focus on these. We do not want to have recall of information, and we want to go beyond understanding. We want to actually start with the application. Right, assessment in an integrated curriculum, the written assessment, one is integrated MCQs, and a good example is extended matching questions. And we will be talking quite in detail about the extended matching questions with many examples. And then the structured essay question can be both the short essay question and modified essay question. But in this session, we would be talking about structured essay questions. So main areas which we are going to discuss is extended matching questions and the structured essay, short essay questions. Looking at the multi-subject integrated multiple choice questions for medical students, just to get the concept. Multi-subject integrated multiple choice questions, also known as clinical vignette-based multiple choice questions, offer a comprehensive approach to assessment and learning by combining multiple subjects within a single question, right? So this is a major focus where we combine multiple subjects in a single question, and we will see that how extended matching questions can help us to achieve that end. These questions are designed to evaluate a student's understanding of interconnected concepts across different medical disciplines. Like I said earlier, that we combine the different subjects in a single question, and that's how this interconnected concept across different medical disciplines such anatomy, physiology, biochemistry, pharmacology, medicine, or surgery can be assessed. The key features of the integrated multiple choice questions: one is they are clinical scenario based. The questions are based on real life patient cases. Of course, we can modify them to make as realistic as possible, requiring students to apply their knowledge to solve a clinical problem, again, based on the level of training of the students. Multi-subject integration, these questions often require knowledge for multiple medical disciplines. So when students are attempting these questions, they have to they are required to think about through multiple medical disciplines, anatomy, physiology, and others. Critical thinking, the questions encourage students to analyze the information, consider different possibilities, and select the most appropriate course of action. This is really challenging, where the students have to analyze the information and come to a conclusion and decide that what should be what the action required to solve that problem. If we use these questions, they would encourage students to have active learning, because as we all know that assessment drives learning. The way we assess the students would prepare for assessment in that particular way. Students actively engage with the material, requiring them to retrieve and apply knowledge, which can enhance learning and retention. So if we are using these types of questions in assessment, obviously they would force students to learn in the integrated way. Application of knowledge, as I said, that's the minimum level 3 of the Bloom's taxonomy, which we are aiming at. These questions assess not just recall of information, but also the ability to apply it to a clinical context. Right, now, having that concept and having the requirements and knowing what we actually want to achieve from this, the integrated questions, let's look at the extended matching questions and how these type of questions meet our expectations and requirements. The salient features of extended matching questions for medical students are designed to assess knowledge across different subjects, disciplines, and encourage holistic learning. If you remember the summary which we which we could draw after going through the initial section, so it covers those areas. Extended matching question can effectively test problem solving abilities and higher order thinking, making them valuable for evaluating medical students' readiness for clinical practice. And this is what we thought we want to do. And extended matching questions are valuable tool in medical education, promoting deep learning and preparing students for the complexity of clinical practice. So let's keep these 3 points in our mind. Assess knowledge across different disciplines with holistic approach, and the problem solving abilities, higher order thinking, and making them ready for clinical practice, and promoting deep learning among medical students. Now, here are some benefits of extended matching questions. I will just read the titles, because otherwise we would be repeating so many things. So first is comprehensive assessment. The first benefit of extended matching questions is a comprehensive assessment. Second, higher order thinking skills. Third, real world relevance. Fourth, efficiency. Fifth, foundation for future clinical practice. Sixth, assessing holistic understanding, and promoting critical thinking, improving learning, preparing for real world scenarios, and assessment of integration of knowledge. If you see, all these points are what we require to assess in an integrated curriculum, and extended matching questions meet that. Now, here I would give you an example to get an idea that how do these extended matching questions look like and what are their components. So first we start with the theme. Remember, we were talking about using, for example, similar or same themes as we are using in our timetable. Let's say the theme here is chest pain. Excuse me, is there any? Okay, now the theme here is the chest pain. And then next is the option, or we can say also the distractor, which is causes of chest pain, like angina pectoris, dissecting aortic aneurysm, gastroesophageal reflux, preherpetic neuralgia, and panic disorder. If you see here, the options or causes come from very different areas. Angina pectoris, dissecting aortic aneurysm, then we are talking about gastroesophageal reflux, we are talking of preherpetic neuralgia, and then is panic disorder from psychiatry, for example. So this is our list of options. The next is what we call is lead-in statement, and it directs students that for each of the following patients with chest pain, select the most likely cause from the option list provided. Each option may be used once, more than once, or not at all. I'll go into the detail of this, what is option and what is theme, what is option, what is lead-in statement later on, once we have finished this example. But here it is important to note that each option, like the 5 options we have given there, may be used once, more than once, or not at all. We call it extended matching questions because usually we would have 5 options and 3 scenarios, so that there is no automatic matching. If we have, let's say, 5 options and 5 scenarios, and the last one would be matched automatically, so we want to avoid that. Now, looking at the scenarios, now here I would need help from you. It's not that I'm going to assess your knowledge, but it is to assess these statements or scenarios and to make a diagnosis on this scenario and then match it with the options we have. Let's look at this. A 72-year-old man presents with worsening chest pain of 1 hour duration that feels like someone tearing my chest. The pain radiates to his back. On examination, the blood pressure is 160 over 90 millimeter mercury in the right arm and 105 over 70 millimeter mercury in the left arm. A murmur of aortic regurgitation, not previously present, is heard. So let's say we have people from all different disciplines. Can we, let's say, guess a diagnosis or make a diagnosis on this? I would like all of you to contribute. What could be the possible diagnosis of this scenario? Especially if somebody from medicine. Yes? Just guess, because I want to test whether this scenario is appropriate or not.
Sir, we are posting in the chat.
Sorry?
Sir, we have posted in the chat.
Can you say it?
Aortic dissection.
Okay, right. Okay. So that's one diagnosis made. Does everybody agree with that? So let's say, okay, that's our diagnosis for this. and we see if this is there in our option list. Yes, it is there. Aortic dissecting aortic aneurysm, and this is one way of assessing our question. The way I'm asking now is to, let's say, give this scenario to different colleagues and see if the scenario is good enough to arrive at a right diagnosis. Let's look at the second scenario. A 48-year-old man presents with recurrent episodes of burning chest pain located at the level of lower sternum. The episode lasts 15 to 45 minutes. The pain is often precipitated by lying supine or eating a large meal. Anyone can come up with a likely diagnosis? Sorry?
Gastroesophageal reflux.
Gastroesophageal reflux, and C, yes.
Yes, good.
Yeah, we have it in our option list, right? So this means that these two scenarios are designed quite well. The next scenario, a 60-year-old man presented to the emergency department with a 2-day history of sharp burning chest pain localized to left mid-thoracic area, radiating laterally along the chest wall. He described the pain as constant, 6/10 in intensity, and aggravated by light touch and movement. He denied shortness of breath, palpitation, or exertional component. So most likely diagnosis, a bit difficult one. The
Herpetic neuralgia, sir?
sorry. All right.
Herpetic neuralgia?
That's right. That's right. You see the
Herpes zoster.
yeah, because the hint is here, light touch and movement, right? So as you know, that is one of our options. The next, let's say it's a long scenario here. A 40-year-old lady presents to the emergency department complaining of sudden onset chest pain and shortness of breath that began approximately 30 minutes prior to arrival. She describes the chest pain as tightness and pressure located centrally without radiation. Associated symptoms include palpitations, dizziness, numbness in her hands, sweating, and feeling of impending doom. She reports that the episode began while she was sitting at her desk at work with no physical exertion. Similar episodes have occurred before, but this one felt more intense. She denies fever, cough, or recent illness, no nausea or vomiting, no previous history of cardiovascular disease. So most likely
Panic attack, sir.
Angina.
Panic.
all right, absolutely right. Panic attack.
Panic attack.
Right. And the last one, a 50-year-old man presents to the emergency department with the central chest pain that started 30 minutes prior to arrival. He describes the pain as pressure-like or squeezing in nature, located retrosternally, radiating to the left shoulder and jaw with intensity of 7/10. The pain lasted for 10 minutes and relieved partially with rest. He mentions that similar milder episodes have occurred over the past 2 months during physical exertion, but this episode was more intense and occurred with less activity. He denies nausea or vomiting, but reports slight shortness of breath. So this would be
Angina.
Angina.
Now let's go back and look at the options, right? So we have these 5 options coming from different disciplines. And then we have these scenarios, and students have to match those scenarios with these options. Although here I have 5 options and 5 scenarios, but in real practice, we would have 5 options and maybe 3 scenarios, or maximum 4 scenarios, that so that there is no automatic matching. So in this way, you can see that in one question, we can integrate different disciplines to assess a student knowledge in an integrated way. Now, you might be thinking this is a clinical, and obviously it's much easier to do in clinical, but how to do it in preclinical, and we will address that in a short while. So any questions so far before we move further? Anyone has any question? Okay, let's look at,
Dr. Malay,
sorry.
sorry. Is there any limit to the length of the scenario, number one?
Right,
Number two, that you have said that the option can be selected once, more than once, or
right,
not at all.
right.
So the matching of 5 to 5, 5 options and 5 scenarios still can be valid. Yes?
Yeah, but again, there is a chance of automatic matching in the last one. You might know 4, but you may not know the 5th one, and that might match. Although you are right, theoretically, yes, we can still have. But if we have, let's say, 5 options and 3 or 4 scenarios, one is that it reduces your workload as well, and we can achieve still the reliable and valid result without making so many scenarios.
Regarding the length of the scenario, please.
Yes, although here the 2 of my scenarios are quite in detail, but we must make is as short as possible, and we'll try that the scenarios must match in their length.
Excuse me, sir.
Yes,
Yes,
yes.
yes.
Yeah.
How much time should be allocated for each extended matching question?
Yeah, so this would be, let's say, if we compare with our single best answer question, and if we have 3 scenarios, so we should be thinking between 2 and 3 minutes.
My question is,
yeah, maybe.
I have a question.
Yes, please.
This looks like a single best MCQ, not TMQs.
Single best answer, sorry.
This is single best MCQ.
Yeah.
You just talk about. This is not a EMQs. EMQs are a little bit different.
This is what we are talking about is extended matching question, or EMQs. But I was saying about single best answer just to calculate the time.
Okay.
For single best answer, we give 1 minute, but for extended matching question, we would be giving around 3 minutes.
Okay.
In that sense, I was talking about. Okay, now let's look at in a bit detail on the structure of extended matching question. As you saw, it starts with the theme. Then there are options or distractor list. Then is the lead-in statement. And finally is the stem or scenario. So each MEQ would have these 4 components. The theme based on the learning outcome. The themes are identified based on the learning outcomes when we make, let's say, the assessment plan, and we have this blueprint for assessment. So we would identify the themes based on our learning outcomes, and theme may be a symptom, maybe a sign, or maybe a laboratory finding, or maybe a situation. Symptoms, for example, chest pain, cyanosis, edema, In the respiratory system, it can be difficulty in breathing or noisy breathing. In GIT, would be jaundice, abdominal pain. Genitourinary system, burning micturition or hematuria. CNS headache or changes in conscious level. Musculoskeletal system, maybe backache or muscular weakness. Hemopoietic system may be bleeding tendency or increasing pallor. Signs may include, let's say, tachycardia or a murmur, wheezing, stridor, hepatomegaly, splenomegaly, or tenderness, facial puffiness in genitourinary or lesions at the genital area, CNS sensory loss or hyperreflexia, MSK, gait problems, limited movements at a joint, or hemopoietic system bruising and lymphadenopathy. So you can see actually there is a huge list, and we can draw so many these themes. If we go to the investigation or lab findings, we can talk about ECG, echocardiogram, or cardiac enzymes. In the respiratory system, we can use chest X-ray or peak expiratory flow rate record. Radiological findings in GIT or biopsy results. Genitourinary urine examination findings or ultrasound uterus, for example. CNS, maybe CSF findings or CT scan, or electromyogram, muscle biopsy report in MSK, or a full blood picture or hemoglobin electrophoresis in hemopoietic system. So this is just, I'm giving these examples to illustrate that actually there are sort of countless options for identifying themes. Now, coming to the second, which is the option or distractor, we can use causes or signs, symptoms, differential diagnosis, pathophysiological mechanisms, investigations, management, and the other distractor which are plausible. Again, there would be the sort of numerous options, numerous areas which we can use based on this, and some of this would be used in preclinical and some in clinical. I'll show you in some examples in a short while. Then lead-in statement, yes, this is a standard. So for each of the following scenario, choose the most appropriate. And then here we use the title of option, for example, mechanism of action, response from the option list provided, and each option may be used once, more than once, or not at all. And then is the scenarios. Our stems, short statement describing a situation or clinical vignette, real or realistic, classical, clear. That's important. Because this is undergraduate students, so when the stems or scenario should be very, very clear, no ambiguity. And then is the properly worded, not giving a clue, such as using in the same phrases as in the options. The different topics of integrated multiple choice questions can be the case-based questions, where the multiple choice questions that present a clinical vignette and ask students to identify the most likely diagnosis, treatment, or next step in the management. Or they can be scenario or situation-based questions, multiple choice questions that represent a scenario involving multiple factors and ask students to apply their knowledge to make an informed decision. That's a situational judgment that we give a scenario where and the students are asked to make the decisions. Public health, presenting a public health issue and asking the student to evaluate the effectiveness of different intervention or strategies. Ethics and professionalism, presenting a clinical dilemma and asking the students to identify the most ethical course of action or professional responsibility. Can be clinical reasoning, presenting a patient case with symptoms, history, and findings, and asking the students to determine the most likely diagnosis or next step in the management. Differential diagnosis, providing a set of potential diagnoses and asking the student to identify which ones are most likely based on the patient's presentation. That's what we used in the example on the chest pain. Pharmacology and therapeutics, presenting a patient scenario and asking the students to select the most appropriate medication dosage or treatment plan. This means this would be a two-step where students have to, based on the scenario, would have to make a reasonable diagnosis, and based on that diagnosis have to choose the most appropriate treatment. So this would be a bit more searching. Right, so that is about the topics, and we can see that actually there is no problem in picking up the topics. There could be so many the options available to us. Now, how to write effective integrated questions? The first is create questions that present real-world clinical scenarios to increase the relevance and applicability of the content. And here we might need help from the clinicians. Because in integrated curriculum, the basic science staff and the clinical staff, they are supposed to work together so they can take help from each other. Design questions that require students to apply, analyze, and evaluate information rather than simply recall facts. Then focus on learning objectives, that's the themes. Ensure that MCQs align with the desired learning outcome for the specific course or module. I think this is very important. When we are choosing themes, we should keep in mind what are our learning outcomes of the course. Then formulate or choose clinically important options. Make the distractors as plausible. Yeah, that's very important. If the distractors are so obviously false, then they lose their usefulness. So they should be as close to the diagnosis as possible. And choose clinically important or realistic scenarios. Right. Any questions so far before we go on to now different examples, both in medical, in basic and clinical sciences of extended matching questions? Anybody has any question? Please mute yourself. Please mute yourself.
Hypertension, heart diseases, and a shorter life.
Dr. Zubia, please mute yourself.
Yeah, please mute yourself. Okay, any questions before we move on to different examples? I think these examples will really help to understand the concept of integrated questions, both in basic and clinical sciences. Okay, let's look at the three broad categories. One, integration between clinical specialties, let's say cardiology and rheumatology, which would be horizontal integration in clinical areas. Similarly, there may be horizontal integration in basic sciences, let's say anatomy and pathology, for example. But what we are aiming is at the vertical integration, application of basic sciences knowledge in clinical situations and vice versa. So questions with both horizontal and vertical integration would be the best option if we can have. Now look at here. Now let's start with the basic sciences there. And the theme is cyanosis. And here is the integration between basic sciences itself. So theme is cyanosis. Options, pathophysiology of cyanosis. One, A is hemoglobinopathy. B is impaired gas exchange, C mixing of oxygenated and deoxygenated blood, D poor perfusion, and E muscular obstruction. So these are the 5 options, which each one is related to the pathophysiology of cyanosis. Then is our lead-in statement. For each of the following scenarios, choose the most appropriate pathophysiology of cyanosis from the option list provided. Each option may be used once, more than once, or not at all. And then is the scenario. The first one. A patient is found to have cold and sweaty hands, weak and rapid pulse rate, and low blood pressure, and is diagnosed to have shock. 1. Second scenario, patient presents with acute shortness of breath and pinkish sputum while on treatment for lobar pneumonia. And 3, the infant was diagnosed to have tetralogy of Fallot at the age of 2 months. Now here we have 5 options: hemoglobinopathy, impaired gas exchange, mixing of oxygenated and deoxygenated blood, poor perfusion, and vascular obstruction. And these are the scenarios where students have to match. So patient is found to have cold and sweaty hands. So this patient is in shock, and we know that the pathophysiology in shock would be the poor perfusion. The answer would be the D. The second is patient presenting with acute shortness of breath and pinkish sputum while on treatment for lobar pneumonia. So that favors the diagnosis of, let's say, pulmonary edema. And it would be the impaired gas exchange. And thirdly is the infant was diagnosed to have tetralogy of Fallot, so that would be the mixing of deoxygenated and oxygenated blood. So in this way, with the cyanosis, the theme of cyanosis and the pathophysiology of cyanosis, and with these scenarios, we can actually assess the students quite thoroughly with integration, where the situation 1 is shock, other is pulmonary edema, and third is the congenital heart disease. So this is using cyanosis in basic sciences. Now we want to use the same theme, for example, in clinical years. So theme is cyanosis, but now the options would be the clinical conditions: bronchiolitis, pneumonia, shock, tetralogy of Fallot, and tricuspid atresia. And then we have the lead-in statement, and then are the scenario. A 1-year-old child presents with high-grade fever, cough, and breathing difficulty. There are mild intercostal and subcostal recessions. Auscultation of lungs reveals generalized crepitations. 2, a 9-month-old child presents with low-grade fever, cough, and breathing difficulty. There are marked intercostal and subcostal recessions. Auscultation of lungs reveals rhonchi and crepitations. And 3, a 3-month-old infant is brought for failure to gain weight. The baby takes long time to finish his feed. On examination, he has rapid breathing and a hollow systolic murmur with crescendo and decrescendo quality, which is heard along the lower left sternal border. Right, so here the first we are talking about bronchopneumonia, second the bronchiolitis, and third is our option of tricuspid atresia. So you can see the same theme can be used in preclinical as well as in clinical with the changing options and the scenarios. Right. Now, any questions so far? Yeah, I might stop sharing at this stage and see if yes, any questions so far or any comments from anyone looking at the basic sciences and the the clinical aspects. You think they would be too difficult for students or too searching?
Sir, I think you have gradually increased the difficulty level, like in the example of cyanosis,
Right.
for the junior students and then for the senior students. So this is appropriate to their level.
Exactly. Yeah. Obviously, the first thing we want to keep in mind while we are constructing the question, what is the level of the students, whether it's a first year student, second year student, or it is a final year student. So these things would be accordingly. Actually, the process could be that based on your blueprint, you have decided the themes, and there is a coordinator, and that coordinator can share that theme with different disciplines. For example, cyanosis, you share with the physiology, pathology, biochemistry, etc., and ask each department to share one scenario. And in this way, we have made a question, and then we can sit down and vet it together. So that could be the process of constructing these questions. Anybody has? Yes, please.
So besides the extended matching questions, what's your experience about cluster MCQs that we can use for PBLs?
Yes, I mean, there are few other options, like from this, the other, I thought I'll talk about the structured essay questions, but as long as we can keep the spirit, even I have seen some single best answer questions with the options coming from very different disciplines, but the limit there is that you have only one answer. So in this way, let's say to assess what we can assess in one extended matching question, you may need 3 or 4 BAQs to do that. So the one you are talking about, yes, as long as they match these requirements, I think that should be acceptable. Cluster questions, yes. Any other questions? I'm more interested to know from the basic sciences, because there's a lot of hesitation and reluctance from the basic sciences, because the clinicians don't find it so difficult. Yeah, any?
Sir, it is rather contrary, because it is rather contrary because clinicians, they usually do not take out time for such meetings of making this type of MCQs in the assessment cell.
Right.
And usually the basic scientists are relying on the people from pathology department in construction of such questions.
Yeah, Prof. Samina, you are really representing your basic sciences very well. Yes.
Thank
you. Yeah, any other comments or questions before we go on to the next type of questions? Okay, now let me.
Sir,
Yes,
I want to like your comment on the policies of having these, the universities mostly, they don't add these extended matching questions in their assessment methods. Mostly the assessment tools that they use are the MCQs and the SEQs.
Right. No, madam, you are right here. But once we are following an integrated curriculum, we must have integrated questions. Yeah, SEQ, you are right. I'm going to talk about SEQ. SEQs can integrate as well, but we need to have integrated MCQs as well. Because if we are teaching in one way and we are assessing in another way, obviously it's not going to work. So we have to match we have to align our assessment with our teaching.
But
So-
most of the universities, they have acquired the integrated curricula. They are emphasizing on going for integration, but the assessment tools that they are using are mostly MCQs. So we would like you to have more emphasis upon the integrated MCQs, like the cluster MCQs, where different subjects, they can come together and make an MCQ with different components of different subjects in it. And also SEQs, how to make the integrated SEQs.
Yeah,
Sir.
the SEQs I'm going to talk in a short while, but absolutely, I fully agree with you that we have to Dr. Prof. Samina just noted here is that it depends that what level of integration we have. So the questions have to be aligned with the level of integration as well.
True that, sir.
Right. Okay. So let's look at some example of the structured essay question, which to the way we can the integrate. So here is an example. First, let's first do the analytic one, and then yeah, can you see the screen?
Yes, sir.
Right. Okay. Now let's look at this example here. This is in short essay question type. Now here is a scenario. Kamal, a 7-year-old boy, a known case of insulin-dependent diabetes mellitus, was brought with the complaint of vomiting associated with diffuse abdominal pain for 2 days. On examination, he appeared confused and disoriented. He had rapid and labored breathing with acetone odor or fruity smell. His mucous membranes were dry. His heart rate was 140 per minute. Normal is 70 to 110 per minute. And systolic blood pressure was 75. Normal is 97 to 112. Laboratory investigations revealed hyperkalemia, hyperglycemia, ketonemia, and metabolic acidosis. And Kamal was diagnosed to have diabetic ketoacidosis. Now, with this scenario, this example I'm presenting is a bit for higher level of students. Later on, I'll use the same example to use in the let's say initial years of medical course. So this scenario, so first question could be, describe any 2 likely causes of diffuse abdominal pain in this patient. Now here we have given a scenario, we have given even a diagnosis that this is diabetic ketoacidosis, but because this patient has abdominal pain, so we want to know what could be the possible cause of diffuse abdominal pain in this patient, and this may be a question from pathology. The second question, explain the pathophysiology of diabetic ketoacidosis in this patient. So this is, we know this is insulin-dependent diabetes. So what could be the pathophysiology of diabetic ketoacidosis in this patient? The third, state the mechanism of acetone odor in Kamal's breath, which is biochemistry. So you can see we have questions from pathology, pathophysiology, and biochemistry. Then we have a clinical question. Interpret the findings. His mucous membranes were dry. His heart rate was 140 per minute, and systolic blood pressure was 75 reported in this patient. So here this would be the clinical component where students have to interpret these clinical findings suggesting of dehydration. Next would be state the clinical response of the body to the biochemical changes as given in the first column of the table below of diabetic ketoacidosis found in this patient. So these are laboratory findings. And then we are asking that for example, for hyperglycemia, what could be the clinical response or symptoms or signs, similarly for others. So this relates to physiology and clinical. And next would be name the organ producing insulin in human body and describe its histology. So this can be from the anatomy, right? So this is a bit higher level of SEQ, where we have given a scenario, but we have questions from 4 or 5 different disciplines, right? Now, if we want to use the same scenario for clinical, then our questions would be different. First question, list 5 questions you would ask in the history to support the diagnosis of ketoacidosis in this patient. Question 2 can be list 4 initial investigation you would request in this patient, giving 1 reason for each. Then there could be question, describe the mechanism of acetone breath odor in this patient. Then list 5 principles of immediate management of this patient. So you can see that the same scenario, we can, depending upon the level of the students, we can have questions related to both basic sciences and clinical. So this is, let's say, the one example. The same, let's say, same scenario, but using for, let's say, for initial years, we can change the scenario accordingly. And this is here. It's still isn't. Let me stop sharing this and then I share the other one. Yeah, here. So if we, now this is one where we, let's say there's some recall of knowledge is there. So we are using the same scenario, but first question is explain the pathophysiology of insulin-dependent diabetes mellitus. Second, explain the mechanism of acetone odor in Kamal's breath. Name 3, name the organ producing insulin in human body and describe its histology. Describe any 3 functions of insulin. Then describe the types of insulin preparations based on onset, peak, and duration of action with given in the table, and explain and interpret the physical findings of heart rate and systolic blood pressure in this patient clinical. State the physiological response of the body to effects as given in the first column of the table below of diabetic ketoacidosis. So here you see that we have some questions based on the recall, for example, types of insulin preparation and based on the onset, etc. Right? So this can be or describe three functions of insulin, again based on the recall. So and the name. Sorry,
excuse me, sir.
Yes, please.
So here I would like to highlight, with your permission, one important thing, that sometimes the basic or clinical teachers, they start making the questions under the scenario as independent questions.
Right.
And they do not connect it with the person in the scenario.
That's right.
So this is very important. Like, instead of asking what is the pathophysiology of insulin-dependent diabetes mellitus, it can be asked, what is the pathophysiology of the type of diabetes in this patient?
Absolutely right. Absolutely right. That we must connect to the patient. Basically, you are absolutely right, and I fully agree with that. Here I was trying to to give an example of, let's say, students at the initial level, but absolutely right. I fully agree with you that ideally I would explain the pathophysiology of diabetes in this patient. So they have to pick up that this patient has insulin-dependent diabetes, and fully agree with that.
Thank you, sir.
Yeah. So in this way, like I have given the examples of both let's say, integrated multiple choice question and the structured essay questions. These type of questions can assess the integrated knowledge of the questions. Now, I'll give one or two more example, and then we can have some hands-on activity. Here, it's screen visible?
Yes, sir.
Right. Okay. Now, just one or two more examples of, let's say, basic sciences here. Now, the theme is liver function test. And these are the components of liver function test: albumin, alkaline phosphatase, aspartate transaminase, and GGT, and unconjugated. I think I shared this question before as well. Then is the lead-in statement. And then we have this scenario. A 7-year-old child presents with generalized edema, right? So you might have seen this question because I shared it earlier. The second is, for example, the theme is anemia. And then we have options: causes of anemia, folic acid deficiency, G6PD deficiency, iron deficiency, spherocytosis, and thalassemia. And then is the lead-in statement. And then are the scenario: a 2-year-old child with hypochromic microcytic anemia and increased total iron binding capacity. So the second scenario, a 3-year-old child with hypochromic microcytic anemia with increased level of fetal hemoglobin, and a child with acute onset of anemia and jaundice after taking some traditional drugs. So the iron deficiency anemia, thalassemia, and hemolytic anemia. So I hope these examples can help to understand the concept better. Right. Any questions before we start our short hands-on activity?
Excuse me, sir, can you please share a template so that everybody can make the questions based on that template?
All right. Okay. I think after this, I will share a copy of this PowerPoint. So template would be there in that.
Sir, may I interrupt? There are certain confusions in the mind of paper setters to differentiate between SEQs and SAQs.
Okay, sir. The one simple difference is that when we say SEQ, the short essay question, so the demand of essay is that answer should be at least a paragraph. Short essay question, right? So we give a scenario and let's say we may say discuss or explain or differentiate or compare those verbs. Whereas short answer question is that it can be just one line or few words. For example, we have given the finding of arterial blood gas. And the question is that interpret it. So answer may be only, let's say, metabolic acidosis. So short answer is, we can differentiate based on the answer. The short essay question, the answer must be an essay of few lines, whereas short answer question is the answer is maybe only few words. So in the other difference would be that in short essay questions, the scenario is long, and then in short essay question, the scenario is short but answer is long, whereas in short answer question, the scenario is long but answer is very short. So I hope that that can help. So if we keep in mind, definition of essay is at least a paragraph, and short answer may be just few words.
Thank you very much, sir. Thank you.
I hope that answered. Yes, any other questions? Okay, so we have, let's say, can we make groups here? We have, let's say, about 10. So I'll make 2 groups, and then each group can come up with at least one integrated this multiple choice question, and then we can discuss. So that would be a short exercise, and mainly is to address if there are any ambiguities. So let me make the breakout rooms. All right, welcome back. I hope you had a fruitful discussion. Can we ask the room 1 representative to present your question, please? You can share the you can share the screen. Representative from room 1.
Time was too short. We were just discussing. We were unable to make any presentation.
What kind of issues you had? Can bring up the issues.
That was a gynecological problem. Dr. Memuna will.
Sorry?
Dr. Memuna has described it, and that was a 6-month old pregnant lady, twin pregnancy, thyrotoxicosis.
So what was the theme? Can you on your camera, please, video, so that we can see? Everybody can. Yes, Dr. Jamshed. Yes. What was the theme?
Theme, we have not decided the theme. That was pregnancy-induced hypertension, I think.
Pregnancy
Induced hypertension.
Yeah, so theme would be hypertension. Theme would be hypertension because pregnancy induced would be.
Should I say this to Dr. Alim?
Yes, please.
Sir, ऐसा है कि I am talking about this patient which is at the present in the ward. She is admitted. She is Gravida 3 para 1 with abortion 1.
Right.
She presenting complaint of known case of hypothyroidism for last 3 years.
Right.
She is known case of diabetes for last 3 years. She has now conceived with twin pregnancy. At the moment, she is 26 week plus, and she is having pregnancy-induced hypertension, and she reported with presenting complaint of pain in the lower abdomen and dyspnea and difficulty in breathing.
So
And
you
at that
were
moment, when
working
she
on
is
this
admitted,
short essay question. So you were working on short essay question?
Yes.
All right. Okay. So you were not working
I just I just presented this case which is present in the ward,
Right.
and that is why we can make MCQ and as well as I think SEQ, both we can make it if I think so. You are the better person to guide us.
All right. So you have a scenario.
So she was admitted, and she as जो treatment उसके investigation जो की गई थी thyroid पे प्रोफाइल उसका किया गया था, डायबिटीज के एंगल से HbA1c के साथ ब्लड शुगर प्रोफाइल किया गया था। इसके अलावा PIH की वजह से PIH प्रोफाइल किया गया था। PIH प्रोफाइल में यूरिन प्रोटीन आया तो थोड़ा प्री इक्लेम्शिया वाला, यूरिन प्रोटीन 1+ प्री इक्लेम्शिया वाला था। पेन लोअर एब्डोमेन थी, तो उसको जो मेडिसिन दी गई थी वो एडेलेट दिया गया था। एडेलेट SR वो BP भी कंट्रोल कर रहा था, प्रीटर्म पेन को भी कंट्रोल कर रहा था। और थायराइड के एंगल से हमने एंडोक्राइनोलॉजिस्ट को दिखाया, उन्होंने एक पहले एक टेबलेट ले रही थी, अब उन्होंने 2 टेबलेट लेनी शुरू
Madam,
की।
yeah, this can be actually really a good short essay question. You have given a scenario, and the important would be that the questions should involve different disciplines, right? So in this, for example, you can very easily do pathology, very easily can do pharmacology. It's a hypertension. You can also include medicine. So there could be many different disciplines involved. The only thing is that while
इसमें
using this scenario, you should not
इसमें
just focus on ONG. You should focus on other disciplines as well.
सर इसमें हम लोगों ने जो ऑफिशियल किया हुआ है ना, हमने न्यूट्रिशनिस्ट को भी इन्वॉल्व किया हुआ है ताकि उसकी डाइट एडजस्टमेंट करे। हमने एंडोक्राइनोलॉजिस्ट को भी इन्वॉल्व किया हुआ है जो थायराइड के एंगल से डिस्कस करे। डायबिटोलॉजी के हिसाब से हमने मेडिकल स्पेशलिस्ट, डायबिटीज और हाइपरटेंशन के हिसाब से मेडिकल स्पेशलिस्ट। लेकिन हम इन सारे एंगल से, हम वार्ड में हर वक्त तो वो खड़े नहीं होते, हम सारे एंगल से जब भी उसको देखते हैं सारी चीजें देखते हैं और उनको फिर कॉल करते हैं।
Yes, yeah, that's why I'm saying it can be a very good structured essay question where you can bring so many different disciplines. So the essence is that the integrated question must not be only limited to ONG in your case. It should involve both basic sciences and clinical sciences. So pathology, can be involved, physiology can be involved. Similarly, medicine, as I said, medicine, you are endocrinologist, you are involving. So the question, it's important that how do you frame your questions? How do you frame your question? That scenario is there, no problem, because you can pick up any scenario from your, for a clinician, it's not a big deal to pick up a patient from the ward and write the scenario. Important would be that how do you phrase the question. May I suggest that if later on you can make questions on this with this scenario and share in the group. Prof. Memuna. Yeah, use this. Yeah, it's okay. It's a we are learning from each other, and it would be very good discussion that you have already the scenario. Just maybe Dr. Jamshed can also help in that. So you can write 4 or 5 questions, but make sure they are from different disciplines, and then share in the group. And I'm sure that would generate a good discussion, because we have this small WhatsApp group, and this would be intact, so we can discuss over the next few days. It would be really interesting, and to see that whether we have understood the concept.
यानी हम लोग सर अगले दिनों में, ताकि मैं आराम से बैठ के क्वेश्चन बनाऊं और डॉक्टर जमशेद के साथ शेयर करूं, और फिर मैं ये प्रेजेंट कर दें या मैं प्रेजेंट कर दूं।
No, after both of you have discussed, you can share in the WhatsApp group.
ठीक है।
And then I think other people would like to comment on that, and that can be a very good exercise. So our means our workshop does not end here. It would continue for next few days.
ठीक है।
All right. Thank you very much.
Thank you, sir.
Okay, room number 2, please. Representative from room number 2.
Sir, there was some problem. We could not actually share the screen in that room. You were not. You did not allow us actually to share
Sorry.
the screen.
I maybe I clicked later, but I had clicked. Yeah.
So, sir, I had written down an SEQ on my own screen.
Right.
Unfortunately, it's not even shared with the other participants of the group.
But
So they would be the first, would be looking at it for the first time.
it's all right. It's all right. You can share it now.
Right, sir. Okay. Share. The page. So let me first close all the others.
All right.
I can't see it on my, okay, it's here. Can you see it, sir?
Yes, I can see. I hope others can see also. You can make the font a bit bigger.
Okay, sir.
Yeah.
I can't change it now, sir.
Right.
After
Okay.
sharing
Okay.
the
It's all
screen.
right. I hope everybody can see the screen.
So it's
Yes.
on the theme of diabetic coma.
Diabetic coma. Okay.
So a person was brought semi-conscious at the emergency department of a tertiary care hospital. Initial examination revealed blood pressure of 90/60 and blood sugar 510 milligrams per deciliter. He was diagnosed with diabetic ketoacidosis. Further investigations showed normal cardiac enzymes and deranged arterial blood gases and a high anion gap. Her potassium levels were also very high. So the questions are, what is the pathophysiology of diabetic ketoacidosis, which will be specifically with the reference to physiology.
All right.
And then what is the clinical significance of anion gap,
Right.
which is pertaining to biochemistry. And what was the cause of hyperkalemia in this patient, which is addressed by both the physiology and the medicine.
Right. Okay, let's see the comments from other participants. I think it's very interesting scenario and a very good effort on questions. Let's see the comments from others.
Sir, I would just like to comment on this, that it's a very
Right.
nicely written, the stem is very nicely written,
Right,
but again, the questions could be answered without the stem.
right,
So if it is the pathophysiology of DKA, then I think giving the diagnosis there
right,
would just make it irrelevant then,
right,
make the case irrelevant.
right. So, but we can say explain the pathophysiology of the, let's say, the illness in this patient.
We can
Yeah,
remove
yes, sir,
this line.
without
He was
giving the
diagnosed
diagnosis.
with diabetic ketoacidosis. Actually, sir, for basic sciences, it's they usually say that you should give the diagnosis in the scenario.
Yeah, that's
For clinical sciences, they say that usually you should not mention it, but for basic sciences, they say that you should focus more on the basic concepts, and you should not the student should not be disadvantaged based on the wrong diagnosis. That's why.
Yeah, I agree that for basic sciences, yeah, we have to sometimes give the diagnosis, but then we can frame the questions. For example,
Yes.
the second one, you can say they discuss the clinical significance of anion gap in this patient.
In this patient, okay,
Right.
sir.
Right.
Right, sir.
So
True that.
yes, diagnosis is given, and that's understandable for preclinical, but we can frame the questions that again, you can also say explain the cause of hyperkalemia or mechanism of hyperkalemia in this patient.
And this patient, yes.
Right.
And pathology as well, because that ketoacidosis
Right.
integrates pathology as well.
Yeah, what I think Dr. Aisha was right in the sense that we should try not to standalone question, what we call is like, for
Yeah,
example, if we say pathophysiology of diabetic ketoacidosis, we may not need the scenario. We can ask without scenario as well. So we should try
So
as much as possible to relate to this. For
Yeah.
example, we can
we
also
can say that what is the pathophysiology of this situation?
or the coma, for example, in this patient.
Of coma. Okay,
Coma,
right,
yeah.
sir. What is the pathophysiology of
So once
coma?
we have given the diagnosis, then we don't talk about the diagnosis in the questions.
Right.
Yes,
sir.
that's
Yeah,
right.
so
True that.
there's a diabetic ketoacidosis. We are not talking about that, but we can
Right.
say, let's say the mechanism or the pathophysiology of coma in this patient. So
So we
Right,
can
sir.
say that to explain the clinical presentation on the basis of pathophysiology.
yeah,
And the key would say that even if they don't write DKA, but can
Yeah.
explain the pathology of it,
Yeah.
it depends on actually how the teaching was done.
that's
So
right.
in our teaching of basic sciences, there are certain core clinical conditions that are absolute for students to know.
Right.
5 or 6 cases.
Right.
So they know the clinical presentation of that very well.
Right.
And the case is given in very much detail when it is for early years,
Right.
and it is of less detail when it is for later years
Right.
with regard to clinical presentation if we want them to make the diagnosis. So
Right.
the key features are given there. So, and the diagnosis is not the aim of the key. It
Right.
depends on how the marking key is created.
Right. There are two observations I need to make. One is that it's all right to give a diagnosis in preclinical years, but then we don't ask questions directly on that, because diagnosis would limit the answer to certain situation. That's number one. Number
Right.
two, remember we were talking about the Bloom's taxonomy of 3 to 5, and the action verbs are given there. So we avoid these words, what is and why or what. We try to use the verbs given there. For example, explain or discuss or differentiate. If you look at the Bloom's taxonomy and the level 3 to 5, the action verbs are given there. So because those action verbs really convey what you want to ask. So because what is the pathophysiology of diabetic ketoacidosis may not convey what you really want to you want to discuss, you want to differentiate, you want to let's say look at the arterial blood gas, or so it's advisable that we use the action verbs depending upon what level we are.
So here comes the major limitation, sir.
Right.
Because I wanted to make a question which should be integrating the subjects and touching the higher levels of Bloom's taxonomy, but then it would be one question and it would not be showing the individual subjects in it.
Right.
So that's why I had to split the questions into 2, 3, so that I should be more clearly showing which subject is going to be checked. So that's the reason behind this poor structure.
Let's say first, for example, your question B, you can easily say that explain the clinical significance of anion gap. Rather saying, yeah, the first one, for example, you can say discuss the pathophysiology of coma in this patient. So that goes for the C, or let's say explain the mechanism of hyperkalemia in this patient. So we better use those action verbs. They are recommended as compared to.
So we can simply say critique on the high anion gap and hyperkalemia.
Absolutely right. Absolutely right. Yeah. If you look at the, please look back at the Bloom's taxonomy and the verbs, the action verbs they are given there. They really are very, very useful. Because
yes, sir. True that.
That make the question very searching. Is any other comment?
Sir, the same case can be very well designed into a cluster MCQ.
Right,
Yes.
absolutely right.
And that would be more efficient in marking. And the shift that we see in many, almost all the medical colleges in Pakistan now, that they
Right,
don't include SEQs. So they go
right.
for MCQs. So we can use cluster MCQs here.
Yeah, absolutely right. Question is that as long as the integration is being assessed, and I mean, here we have two examples of short essay questions, but as and I can understand the integrated multiple choice question is takes time, but once you start making that and you get an idea, it's a fun to make those questions because you learn yourself when you are constructing those questions. Yeah.
सर आई वुड लाइक टू से
Right.
जैसे मैं हमारे जो स्टूडेंट्स हैं ना उनको हम लोग एमसीक्यू मंथली एक टेस्ट देते हैं जितने लेक्चर्स होते हैं
Right.
इस सब एमसीक्यू सब हमारी जब हमने फीडबैक स्टूडेंट्स का लिया तो फाइनल ईयर का जो एग्जाम यूनिवर्सिटी में होता है उसमें एमसीक्यू के साथ एससीक्यू का भी एक पेपर होता है तो
Right.
उन्होंने कहा कि मैडम आप लोग हमें एससीक्यू के ऊपर रिहर्सल कराएं एमसीक्यू जो है वो आप सिर्फ करवा रहे हैं और एक हम एससीक्यू दे देते तो उन्होंने कहा आप ऐसे करें हमें जो है 2 से 3 एससीक्यू दें और बाकी कुछ हमें एमसीक्यू दें तो सर उस एंगल से फिर हमने अभी इनके एससीक्यू जो है वो बनाने शुरू किए क्योंकि
Yeah.
एग्जाम में बाकी
Madam, I think that's a good opportunity for you to really give the integrated SEQ and let students work on that. And when you maybe you can give them as a homework as well that they work on that. And this would be a good practice that when they are working on that, they would be looking at the basic sciences as well as clinical sciences. I think it can be really, really good
मैं
practice.
सर गई हूँ ना अभी यूएचएस में एज एन पेपर सर ये मैं यूएचएस गए ना एज ए पेपर असेसर तो 10 एससीक्यू जो थे वो क्वेश्चंस के तौर पर थे और हर एससीक्यू का नीचे जो क्वेश्चन 3 से 4 क्वेश्चन किए गए थे और
Right.
यकीन करें सर कि वो एससीक्यू का नाम था लेकिन कुछ बच्चों ने इतना अच्छा प्रेजेंट किया हुआ था जैसे वो जो नहीं होता कि निचोड़ कर जो इम्पोर्टेंट पॉइंट्स हैं वो एससीक्यू में लिखें लेकिन सारे इम्पोर्टेंट पॉइंट उससे कंसर्न प्रॉब्लम के साथ वो लिख रहे थे तो वो
Right.
कह रहे थे कि मैं जब वहां से वापस आई तब मुझे स्टूडेंट की बात समझ आई कि वो चाह रहे हैं कि हम लंबी लंबी किताबों के 12-14 वर्गों की बजाय हम एक क्वेश्चन इस तरह का बनाएं कि हम उसको शॉर्ट उसमें प्रेजेंट कर सकें जो मुझे समझ आई आप
Yeah,
इसमें बेहतर
Madam,
गाइड कर सकते
I think that's absolutely right. The open-ended questions have lost their usefulness in science-based subjects. In literature, yes, but in science-based subjects, the structured essay questions are really, really useful. The open-ended questions are not that useful. Professor, Sir Muhammad Aslam, your comments, sir?
Yes, sir. Because now, with the present scenario, we have to align the course content, teaching, and teaching methodologies with the assessment.
Right.
So that cannot be done without the structured question.
That's
And
right.
हमारे वक्तों में सवाल का होता था, describe the pathophysiology of uncontrolled diabetes mellitus, and we were given 1 hour to solve the question. But that was the time.
Right.
That was the reality of that time.
Right. Absolutely right. Yes.
Yes.
Yeah. So, I mean, the situation is, sir, that we have been using the latest approach at that time. Whatever time is, we have always been using the latest approach, and nowadays the approach is like this. I think what Madam Memuna said, that if, let's say, we can just give one SEQ to the students to practice, forget about examination, just give them to practice over the weekend, and that would be really good reading for them because they would automatically reading from different areas, and this can promote integration in their learning as well. So
सर जिस वक्त मैं पेपर पे गई थी ना, तो उन्होंने हमें साथ क्वेश्चन पेपर के साथ की भी दी हुई थी।
right.
तो सर की बनाना आसान, क्वेश्चन बनाना बहुत मुश्किल था, और जिन्होंने बैठ के बनाया था वाकई एक्सीलेंट क्वेश्चन बनाया हुआ था।
Madam, the questions I have presented to you today, I have keys for all. I have model answers for that all, but I did not share with them because the time was limited. Maybe I can share in the group at least one or two of them later on, but we will be waiting for your question, your scenario and question, and hopefully we can continue discussion over next few days on that. Is there any other comments or questions?
I have a comment, sir. If you could there be a possibility that the books might be written in horizontal integrated book in medicine and vertical integrated books in medicine, or what? Because there are hardly any books showing integration. Of course, there are some one like current yearbook of diagnosis and treatment,
right?
But that does not suffice our native requirement.
That's right. So, Prof, I had seen, I think, some books combined on anatomy and physiology as well. But if you see, basically, we can still have the books based on the discipline, because integration actually comes in the timetable. So if we can integrate the different disciplines in the timetable, still the books may be specific, but when it comes to the timetable, and we are, for example, we were talking about anemia. We are not mentioning physiology or anatomy, but we are, let's say, hemopoiesis, or we are the hemoglobin synthesis, or so they can still go to different books, but the integration is there, that the binding theme for that week is anemia, and every subject is contributing to that. So I think that in that way we can go around that.
That means you suggest that the book should also be made thematic at some point of time.
Sorry?
The books may be thematic books.
Yes,
on some period of time. Yes.
I think, Prof, there are books on symptoms and signs.
Yes.
Yeah, the book 100 symptoms or 1,000 symptoms are there. There are books available on that.
Yes.
Yeah, on symptoms, signs, laboratory investigations. Yes.
Yeah. Thank you.
Right. I hope it was a useful session, and at least I have learned so many things from all of you, and we hope to continue this kind of approach in the coming days. I will be happy to answer any other question if you have. You can any question which comes to your mind later on, you can share in the WhatsApp group. We will maintain that WhatsApp group for some time, and you can share your questions, or maybe I will share the one the question with the model answer, the structured essay question as well. So in that way we can benefit from each other. The recording I will share, but because it will take some time for editing those, so in due course of time, inshallah, I will share the recording of the session as well. With that, I thank all of you for your help and cooperation and wonderful discussion.
Thank you, sir.
Thank you, sir.
Thank you very much indeed, sir. Thank you very much.
Allah Hafiz.
So can I request one thing, sir?
Thank you. Yeah.
Sir?
Yes.
Sir, I just wanted that if the group can be left open for 1 week, and all of us share our integrated questions, 1 or 2 samples in the group for the next 1 week.
That would be good. That would be good. I'll leave it open, and I'll invite everybody to share. Because this is not an examination. This is how we would learn
Aisha,
from
we
each
would
other.
love it if you add 2 to 3 questions every day per week.
That would be great. And yeah, if we can do that, that would be great. That would be great.
And lovely to see you, Zubia.
Same here. Same
Yeah.
here.
Old
Yeah.
friends meeting after a very long time.
All right.
Exactly.
Okay. That's
Pleasure is
good.
all mine.
That's good. That's good. Okay. Allah Hafiz.
Thank you
very
please,
much.
अगर मैं क्वेश्चन करूं
Allah Hafiz.
जी
सर प्लीज क्वेश्चन करूं प्लीज खुल कर उस पर कीजिएगा ताकि मुझे अपनी मिस्टेक्स का पता चले जो भी आपको लगे उसमें कोई नहीं ये इम्प्रूवमेंट होनी चाहिए इम्प्रूवमेंट होनी चाहिए तो ग्रुप सारा बेशक खुलकर उस पर डिस्कस
Yeah,
करें
madam,
यही चीज सीखना
yeah,
है
so that, as I said, this is a learning session. So it's nothing too personal about anything. We want to learn from each other, and we want to help each other. Inshallah, we will get some benefit out of that. Allah
Thank you.
Hafiz.
Thank you.